Welcome again. Let's talk about priapism. Priapism is a prolonged erection of the penis. The full or partial erection continues hours beyond or is not caused by sexual stimulation. The main types of priapism are ischemic and non-ischemic. Talking about the ischemic, priapism is a medical emergency. Although priapism is an uncommon condition overall, it occurs commonly in certain groups, such as people who have sickle cell disease. Prompt treatment for priapism is usually needed to prevent tissue damage that could result in the inability to get or maintain an erection, which is erectile dysfunction, much later. Most commonly, it affects a male in their 30s and older, but can begin in childhood for male with sickle cell disease. Symptoms vary depending on the type of priapism. The two main types are ischemic and ischemic priapism and non-ischemic priapism. Ischemic priapism, also called low-flow priapism, is the result of blood not being able to leave the penis. Blood is trapped in the penis because it cannot flow out of the veins of the penis, or there is a problem with the contraction of smooth muscle within the erectile tissue of the penis. While the ischemic priapism is the most common type of priapism and requires immediate medical care to prevent further complications that can be caused by not getting enough oxygen to the penis tissues. So let's talk about the signs and the symptoms of priapism. Number one is erection lasting more than 4 hours or unrelated to sexual interest or stimulation. Rigid penile chart, but the tip of glans penis is always sore. Progressively worsening penile pain, stuttering priapism, also called recurrent or intermittent priapism, is a form of ischemic priapism. So an uncommon condition, which is called stuttering priapism, describes the repetitive episode of prolonged erections and often includes episodes of ischemic priapism. It occurs more often in males who have an inherited disorder characterized by abnormally shaped red blood cells, which we call sickle cell disease. Sickle cells can block the blood vessels in the penis, and in some cases, the condition starts off with unwanted and painful erection of short duration and might progress over time to more frequent and more prolonged erections. When we're talking about the stuttering priapism, it may begin in early childhood, while non-ischemic priapism, also known as high flow priapism, occurs when blood flow through the arteries of the penis is not working properly. However, the penile tissue continues to receive some blood flow and oxygen. Non-ischemic priapism often occurs due to trauma, like accident or something. Signs and symptoms, which include erection lasting for more than 4 hours or unrelated to sexual interest or stimulation. Number one. Number two, erect but not fully rigid penis shaft, usually not painful. What are the causes of an erection? An erection normally occurs in response to physical or psychological stimulation. This stimulation causes certain smooth muscles to relax, increasing blood flow to spongy tissues in the penis. So as a result of this, the blood-filled penis becomes erect after stimulation, and the blood flows out and the penis returns to its non-rigid or flaccid state. Priapism occurs when some part of this system, the blood vessels, the smooth muscles, or the nerves, changes normal blood flow and erection persists. The underlying cause of priapism often can't be determined, but several conditions may play a role in the history of priapism. Then we have blood disorder. Blood-related diseases might contribute to priapism, usually ischemic priapism, when blood is not able to flow out of the penis. This disorder it might be as a result of sickle cell disease, it might be as a result of leukemia and other blood diseases, hematological dyscrasia such as thalassemia and multiple myeloma. This most common associated diagnosis in children is sickle cell disease. So Another thing is prescription medication. Priapism, usually ischemic priapism, is a possible side effect of number of drugs, including medication injected directly medication injected directly into the penis to treat erectile dysfunction, such as Caverget, Edex, and others, Papaverine, Oravas, and others. It can be as a result of antidepressants such as fluoxetine, that's Prozac, Wellbutrin, SR, Trazodone, Tetraline, a whole lot of them. It can be alpha blockers, including Prazosin, Tetrazosine, Dozazosine, Cadura, and tamsulosin. All those medications are some of the medications that can cause priapism. Medication used to treat anxiety or psychotic disorders to risperidone, lithium, olanzapine, clozapine, all of them. Chlorpromazine, that's the Ligatil, and other. Blood thinners such as warfarin or heparin can also cause what we call priapism. Then there are some hormones such as testosterone or gonadotropin release hormone. They are used to treat attention deficit hyperactive disorder in people such as Concerta, Ritalin, and others can also result in that. Alcohol and drug use is one of the factors, like marijuana, like cocaine, heroin, and all this stuff they take nowadays can cause priapism, particularly ischemic priapism. A common cause of non-ischemic priapism is trauma or injury to the penis, pelvis, or the region between the base of the penis and the anus, that place we call perineum. Other factors that can cause priapism include a spider bite, scorpion sting, or other toxic infection, or metabolic disorders including gout or amyloidosis, neurogenic disorder, spinal cord injury, or syphilis, cancers involving the penis. What are the complications? Let's talk about them. Ischemic priapism can cause serious complications. The blood trapped in the penis is deprived of oxygen when an erection lasts for too long, usually more than 4 hours. This lack of oxygen can begin to damage or destroy tissues in the penis. Untreated priapism can cause erectile dysfunction. When do you see your doctor if you're going through priapism? If you have an erection lasting for more than 4 hours, you need emergency care. The emergency room doctor will determine whether you have ischemic priapism or you have non-ischemic priapism. So if you experience recurrent, persistent, painful, and erection that resolve on their own, see your doctor. You might need treatment to prevent further episode. So see you in the next video.